Welcome back to 12 on Health. I have a couple of dental questions for you to think about. If you've made it to adulthood with a crooked bite, why bother getting your teeth straightened out now? And what exactly can you do to preserve your teeth and prevent ever needing dentures later in life? Here with answers is Stanford-based orthodontist Dr. Bob Goldman. Dr. Goldman works with many adult patients to come up with braces that work for them. So I'm thinking they don't want the hot pink across the top teeth.
Not too often, no.
What do they opt for?
Most adults like things that are much more aesthetic and easier to wear.
Right.
So things like
more invisible.
Yes.
Okay. There are more than, there's not just, everyone's kind of heard of Invisalign, and I know you work with that quite a bit. Is that more like it just kind of keeps the teeth, moves the teeth into place with a plastic barrier?
That's exactly what it is. It's a removable clear aligner that fits over the teeth and around the teeth. Patients typically get a series of them. They wear them for 2 weeks, and each one moves the teeth a little bit.
So it's gradually shifting them. Is that a longer process than the other braces?
It's usually comparable if the problems are in any particular person's problems. The comparable time for braces and Invisalign, as long as the case is selected.
So how long would they have Invisalign on for?
Depends on the problem. Could be anywhere from 6 months to 2 years.
Okay. And Invisalign is a little bit more expensive than the others?
Typically a little bit.
Okay.
Not
just
much.
by another few hundred or thousand?
Maybe about 5 to 10%.
Okay, all right. Then there's another option that I'm not familiar with, but you brought it, and we have a picture of it here. It's the braces that go on the inside. What is that?
Yes, they're called lingual braces. They go on the inside of teeth. They've actually been used quite a bit since the mid-1980s when they were developed and perfected. So
you can't even tell they're there?
No, not a bit.
That is
Can't
wild.
see them at all.
And those work just as well, or?
They work just as well, as almost as well as braces on the front teeth. In many cases, they work better than Invisalign, but treatment can take longer. They're just technologically a little more difficult to work with, so sometimes treatment takes about 6 months longer.
Okay, and do they bother the patient having those braces on the inside of their mouth?
Initially they do, especially the lower ones in the back teeth. Most people typically get used to them.
Okay.
But there is the tongue is very sensitive, so there can be a little bit more of a learning curve.
And there's the more traditional braces that are less visible than the ones the kids get.
Yes. We have clear ceramic brackets. You see the wires, but you really don't see the brackets. And the
you can hardly see those. I've met people with them, and you have to spend a lot of time with someone to even realize they have them on.
Right.
It is amazing. Okay, so give me the rough price range.
It's highly variable, especially with adults, since there are many options, and frequently I give patients options for
payment
what we can
options.
do. There are payment plans. It could be anywhere from $2,500 and up if we get involved with surgical things.
Okay.
So it's
It's
a huge range.
The bite, though, how important is that as they get older?
The bite is actually critically important, both for keeping the teeth healthy, the gums healthy, and the jaws and the joints healthy. And
so it's not just for looks?
No, not a bit. That's actually a nice side effect of what we do in orthodontics.
Speaking of this nice side effect, we have some beautiful before and afters we want to show people. The before is not so beautiful, but whoa, check it out. This is a woman, and she obviously had that for a long time. Her bite is better here. How will that serve her? Obviously, it looks better. Why will that serve her better?
In her case, she really wasn't biting on her front teeth at all. So her bite wasn't distributed among all of her teeth. So the back teeth were taking quite a bit more force than the front teeth, which can wear them down, crack them.
Sounds like the case with this patient, too.
Exactly.
And here's a man's mouth. A man actually went to the orthodontist.
Yes, he did.
This is a first. This is a rarity. But look at the difference. My goodness. Did you do some whitening there or something? Something went right.
His teeth were cleaned right before that after picture was taken. We had just taken his braces off.
Okay.
And cleaned his teeth.
And for that last picture, what kind of braces did he get?
He had metal brackets.
Okay, so he went with the basic metal.
Choice. Yes, he did.
And he had them on for a year or two?
About 18 months.
18 months, not bad. All right, there are some things you've told me people can do to avoid ever needing dentures. Right. Whether they're 20, 30, 40, 50, whatever. What do they need to do?
Very basic things. They need to brush and floss their teeth daily.
How many times?
Brushing twice a day, flossing once a day is usually fine, as long as it's thorough.
Okay.
Seeing a dentist regularly.
Okay.
And
once a year?
Once or twice a year, depending upon their problems.
Okay.
If they have any, the dentist will know if they have any gum problems or any alignment problems, and can refer the person to an orthodontist or a periodontist if they need to be seen by a specialist.
A lot of times I understand people are brushing their teeth, but it's not necessarily the teeth that they need to preserve. It's the gums.
That's right. Brushing correctly, which can be shown by a dentist or a hygienist, is important for keeping the gums clean and the bone clean, and that helps prevent periodontal disease so that teeth stay healthy in the bone that they're in and we don't lose the bone.
Is the periodontal disease the main reason people need dentures later?
It's probably the primary reason, although sometimes when people are young, depending upon where they grow up, teeth may be removed instead of being restored.
Okay, soda.
Soda generally is not a good thing. It's got a lot of sugar.
Right.
If one drinks it reasonably quickly occasionally, it's not too bad, but it's highly acidic.
Okay, so don't sip it all day long.
Swishing is not a good idea.
And should you brush right after or hold off a bit?
There's a natural cleaning, so that if you're in the middle of the day and you have a soda, it's really not so bad.
Okay.
The tongue and saliva will tend to clean everything out.
All right. Thank you so much, Dr. Bob Goldman, based in Stamford. Ahead on 12 on Health, we'll tell you about a new state program that gives doctors a way to check on their patients before prescribing potent pills.
These medications are addictive. They can cause a problem.
A crackdown on doctor shoppers in less than 2 minutes right here on 12 on Health.